So the first one is continuous monitoring of ERNs. The idea of the EU is, of course, that they want to monitor the ERNs and their activity, and there is a inter-ERN working group on that because that's a common problem. And the questions that are not solved are very simple question. What is a patient of an ERN? Is that a patient who is going one time in one center of the ERN, or is it the patient who went through the CPMS process, meaning who had some expertise, international expertise? And of course, the numbers are not the same, and the information are not the same. Probably the two are important, but that's not clear. And the other point, which is not easy, is to have patient satisfaction. How you want to measure that? So you've been working on it. We've been discussing that, but it's not finished yet. So some of the indicators that had been proposed: number of member states in the network, members of working groups set up, members participating in ERN meetings, so the activity, the percent of groups with patients, how patients are represented in the working groups, the level of patient satisfaction with the limit that we just saw. Then we have some times which are derived from the pathways: time from diagnosis to treatment, time from referral to multidisciplinary clinical advice, time between referral to ERN and diagnosis. This is very complicated, probably. Then we have survival, mortality, morbidity, which is almost impossible unless you have 100% follow-up of your patients. So these are good ideas, but probably not for today. Number of patients seen, advised by ERNs, so CPMS or HCPs, we discussed that already. Number of procedures performed within the ERNs. Procedures, maybe surgical procedures or whatever. The genetic diagnosis. Adherence to clinical practice guidelines, and the idea would have in the minimum data set with the registry some index that you can use to see if the patient is treated according to the guidelines. For example, does he have an echocardiography if he has an aortic dilatation, or is there a scanner performed or whatever? So, scanner, yes, no, for example. And there is also evaluation of the activity for the research, and as it is the ERN, it has to be 2 HCPs from 2 different countries, the number of grants, the number of patients in a given registry, and the number of clinical trials. So this is just in discussion, because it's actually very complicated. Yeah?
Sorry, Guillaume, the one that we could possibly all meet in our working groups already is not on there, which is publications. But that's how we usually measure research activity. Could publications not go on the bottom of the grants and shared registries and number of clinical trials? Because as we've said, clinical trials is a very, very tough call to meet. And publications would allow us to actually meet a criteria that would look good, I think, certainly.
Yeah, common publication between 2 HCPs. I think it's one thing that we can do. But these are the official, discussion about the evaluation of the ERNs. There is no definitive decision yet, but this is in discussion. Just to inform you. And what will put you in good shape? Who will input the data into the system? The ERN coordinators and the HCP will be responsible for providing the data, which means that we have to find a way for it to be automatic and derived from the electronic chart. Otherwise, it's additional work. And it will be monitored by coordinators and by the EU, and it will be a tool to prepare for the evaluation process. This is not very new.